Reggie Young, and I am the Chief Strategy Officer at Houston Food Bank. I am on the executive committee of the Houston Food System Collaborative, and we cover 13 counties in Southeast Texas, including Harris County.
My name is Valerie Smith, and I am a pediatrician in Tyler, Texas, which is in East Texas, and I chair the Smith County Food Security Council.
Hi, I am TRESHA Silva, and I am the Executive Director of the BASTROP County Emergency Food Pantry, and I'm also the co-chair of the BASTROP Hunger Free Coalition, and our county of service is Bastrop County.
My name is Warren Goodell. I'm the Executive Director of Kelly Center for Hunger Relief in El Paso, Texas, and I'm a member of the Sun City Hunger Relief Coalition, which is in its second year.
My name is Pam Rogers, and I'm a member of the Burnett County Hunger Alliance, and we serve Burnett County in the general Central Texas area.
My name is DEBRA FRANCO. I am a child hunger outreach specialist with the VALERIE Collaborative on Hunger and Poverty in the McAllen Regional Office. And I work with the Medical Health Advisory Committee, and we serve 4 counties in the Rio Grande Valley. They are Hidalgo, Cameron, Willacy, and Starr counties.
Our mission statement is to support those who are fighting hunger in our community. So it could be individuals, it could be companies, it could be foundations, organizations, anyone who's fighting hunger in our community.
The mission statement is to provide a network of food providers, community organizations, churches and schools, local businesses, governments, and concerned citizens to build relationships and communication for working together to comprehensively feed the hungry in Burnett County.
Is to collaborate to influence solutions to the issues our community faces in the area of diabetes, health, and management.
The mission of the Houston-Galveston Area Council is really to facilitate the growth of a sustainable regional food system, and we try to do that through 2 ways. One is through improvements in food access, and the other one is improvements through food enterprise development, which
we came together because the data that was brought to us from Texas Hunger Initiative was very powerful in kind of showing how there were these pockets of area where there were gaps in services. Like we, of course, as organizations that were around the table, we understood it, but just looking at it in that content of the data and stuff that they offered, we were just like, okay, there's definitely a need to figure out how to coordinate and make sure that we are looking at those areas where there are gaps in services and access is limited.
I think there's always been a recognition of the need. The problem is that it's like a basket of kittens. It's got 200 different organizations trying to figure out how to do their little piece, and no one is talking with each other.
I attended a workshop on the ethics of hunger, and it was led and facilitated by Jeremy Everett and his staff of the Texas Hunger Initiative.
What we really begin to realize is that you cannot spend a day in Smith County. You can't go to the grocery store or go to a restaurant or go to church without encountering families who are food insecure, and recognizing that at the same time we had a wealth of resources. We have, a regional grocery store chain that is located in our community, and we have a tremendous number of people who are willing and interested in helping with this issue, but we really needed to have one place where we could all come together and develop strategies around how to get healthy food to our community members who need it most.
We started out saying, okay, how do we change the culture so that hunger is not an acceptable part of our community? And that's a big challenge?
I think it was formed out of sheer need. We identified that there was a great need to manage health outcomes.
It's one of the key pieces I walked away with is that we could end hunger in our lifetime. And in social services, that's a phenomenal statement. Not only did he say that, he said that each community had the resources within itself to solve the issues of hunger in their area.
Originally, when it was the Houston Food Policy Work Group, the idea was that we really needed something to understand and leverage how we could build up a better food system for the region. The original intent of the Houston Food Policy Work Group was that it would eventually become a Houston Food Policy Council of the city of Houston. And so that was the original intent. And with the rebranding, the new intent was essentially that policy is a component of the food system, but there's so many other aspects of the food system that policy has to be a part of, but we really wanted to emphasize some of those other aspects of the food system to really ensure that the food system within the region was going to be as strong as it could possibly be.
One of the most successful programs that we've developed is a healthcare food bank partnership, where clinics screen patients for food insecurity using the Hunger Vital Sign, which is a simple 2-question screen that's been validated in multiple languages and across multiple different settings. And when they identify a family who's food insecure, then they're able to offer them enrollment in the Partners in Health program. And that program helps provide them with 12 weeks of both fresh produce and shelf-stable healthy foods, as well as nutrition education and opportunities to enroll in WIC or SNAP if they're eligible.
The biggest problem in town is how do you feed the homebound? Because the pantries don't deliver. We don't have a Meals on Wheels in El Paso. What do you do? And as sort of an adjunct to that, the county is looking at the SNAP gap and saying, boy, if we had all this money in our economy, wouldn't that be great? So we've been looking at what are the barriers to signing people up for SNAP, and it's very depressing to do that because most of the barriers are institutionalized in the government rules, changing rules, and complexity of the application.
That September for us in Burnett County is Hunger Awareness Month. And during this month, we have the County Commissioners Court and the county judge issue a proclamation, and we also get information in the local news media about the food pantries, community kitchens, and the issue of hunger in our area. In past years, we've attended all of the city council meetings and 2 different school board meetings to educate people and also issue proclamations. The pandemic has kind of precluded us doing that on that level or that scale. And so we've kind of toned it back for this month.
The coalition's work that's been really, really strong is around our food assessment. That has been some very, very, very valuable information. And it involved every person at the table working together to pull that all together.
From the coalition, we began a specialized food pantry that gives fresh fruits and vegetables as well as other healthy foods to participants. A specialized free clinic that sees uninsured patients that need specialists for chronic diseases such as diabetes, and a community garden that educates participants on cultivating their own vegetables as well as teaches them how to cook and store them.
Beyond that, we also have a work group that's focused specifically on SNAP access and increasing SNAP access. One of the great things that have come out of that group is that we also have a subgroup called Double Up Houston, which really works to provide SNAP benefits at farmers markets within the region to where people that are attending that do have SNAP benefits can double up the amount of produce that they can receive with their SNAP access. And so that's one of the ones that we're really excited about that's been going on for about a year now.
I think that's what makes us work well. We understand the need for the coalition and the structure that the coalition can bring to the whole process of food insecurity.
I think the first thing that went well was when the foundation pulled its financial support from our executive director, and we had to figure out how to go about being as effective in the future. So what we ended up doing was deciding to incorporate, and then we've got our 501c3 thanks to one of our volunteer members who's also a lawyer and loves doing that kind of stuff.
Before the Hunger Alliance, food pantries in Burnett County, and we have 4, and community kitchens, and we have a number of those, weren't really talking to each other. They were acting kind of like as singular entities, like silos. And now they very much talk to each other, share resources.
But in addition to having the food and providing fresh produce, we would also host several of our, usually between 10 and 15 of our partner organizations, who could then do outreach and help enroll or provide health screenings for community members.
One of the biggest benefits, I think, also has been being a part of the Hunger Free Communities Coalition. And getting to be listen in on what other people are doing across the state, and kind of gleaning from those ideas and implementing a lot of those opportunities within our own network.
And one of the good things about the network that we have with Texas Hunger Initiative is that we were able to leverage a lot of their resources to go through the process and make the process a lot easier for us to be able to get the tools that we needed in order to be successful in that revisioning. And so
I would like to see the coalition gain some steam around going back and looking at some of those things that we identified in our assessment that were areas that we wanted to tackle, and then setting up the groups, the resources, and bringing the people to the table that can help us tackle those things.
And really, I think my goal for the coalition overall is that we start to be able to track some outcomes to see that we really are making a difference, especially in our highest need populations.
One of the biggest projects that we are hoping to work on within the near future, and so essentially within the next few months, is a food shed assessment. And so essentially what that means is that we're really looking to identify some of the opportunities within the food system where we can really leverage the enterprise side of our work. So,
I know the Hunger Alliance really hopes to continue its focus on child hunger. That's been a focus of ours for many, many years.
Well, we constantly talk about the need for sustainability and are constantly working towards a new collaborative effort and volunteer basis to continue the work that we've started.
So our goal is to raise the number of people living above 200% poverty from 53% to 63% in 5 years, 10 years, whatever the time frame works out to be. It's one of those big, hairy, audacious goals that, but if you don't start somewhere, nothing happens. So.